welcome to Inside WRHN, and I'm very pleased to welcome you to share a little bit about what's happening at WRHN behind the scenes. And today, in our first episode, I'm joined by Dr. Heather Warren, who is the Vice President, Medical Affairs, and a clinical cardiologist practicing at our hospital. So welcome.
Thanks for having me.
Yeah, we're very excited to hear some of the inside scoop at WRHN. But so what got you into cardiology?
So the thing that really drew me first and foremost to cardiology was the diversity of practice. Mm-hmm. It's one of those rare areas in medicine where you get the whole gamut. You can be providing acute life-saving care in the coronary care unit one day, following patients in heart function clinic the next week. You get that combination of the acute as well as the longitudinal care. Some of my patients I've been following for well over a decade. Oh, wow. I've seen pictures of their grandkids. I've seen pictures of their, grandkids' weddings. So it's you get to have both of it, and that's not too many areas of medicine where that's your experience. But I think the thing that really drew me to it as a trainee was the contribution to quality of life. Cardiac disease can really rob people of their independence, their ability to live an active, healthy life, to work, to be independent. And cardiology is really an opportunity to contribute to their regaining that independence, and that's a pretty powerful thing to be a part of.
Now, you also have a role in the leadership of WRHN. So can you talk a little bit about your role there?
Oh, absolutely. So I wear two hats. At my core, I'm still a cardiologist and a physician, but I'm very privileged to be part of the leadership team at the Waterloo Regional Health Network in my capacity as Vice President of Medical and Academic Affairs. And so through that role, I get to help shape the care delivery across our organization on a broader level, not just within the cardiac portfolio, but all of the services that we provide.
Great. I'm going to talk a little bit about our Center of Excellence at WRHN, the Cardiology Center. And, it's really depending, our community depends on this service. Like Lane, who in December, he and his wife got stuck in the snow and had to push their car out. And he woke up a few hours later in the coronary cardiac unit, not knowing what happened. But he had a massive cardiac emergency and depended on our services at Queens Boulevard. Can you talk a little bit about our program and what we do?
Sure, absolutely. So the Regional Cardiac Care Center, formerly St. Mary's, now Waterloo Regional Health Network, has been a regional cardiac care center now for over 20 years. Prior to that, all of patients like Lane would have had to go out of region for care. And that's a really important point, because there's a saying in cardiology that time is muscle. When there's no blood flow getting down one of the arteries of a heart vessel, or if there's no blood flow getting to the brain in the case of a cardiac arrest, with every passing moment, there's more permanent damage done. And the difference between getting care here locally can be the difference between survival or survival with return to independence. And with each passing moment, the likelihood of that decreases. And so cases like Lane, that's really a testament to being able to get the right care at the right time at the right place.
And it's so incredibly important.
Absolutely.
Especially for the outcomes.
For sure.
Quality of life depends on it. It's just amazing. And what stands out to you about our program?
So we really are proud to say that we have a cardiac center of excellence. When you drill down to what that really means on a tangible level, it really comes down to, three things. For me, it's the experience of our team, the efficiency of our team, and honestly, overall heart. I use that literally and figuratively. Our program is not just renowned in the region, but on the provincial and national level, for providing high quality care. We're always ranked in the top, groupings of cardiac programs for outcomes in the country, and certainly across the province. But what's more remarkable about it is that we do it with the resources we currently have. So currently we have 2 cardiac catheterization labs, or cath labs, what we call them for short. Through those 2 labs, we put through similar volumes that many cardiac programs put through in 3 to 4 labs. And that's really a testament to just the expertise, the skill, and the spirit of innovation amongst our teams to be able to provide such high volume care to the patients that we serve with those limited resources. But excellence isn't just about numbers. It's about the experience that the patients receive and what they have when they walk through our door, and also about the outcomes that they walk away with that impacts their life on a long-term basis. And I honestly could not be prouder to be part of this team here at WRHN. They just do phenomenal work.
And it's not just Waterloo Region, but it's beyond, right?
Well, absolutely.
Like Robert was in Lion's Head, and he had to be airlifted to our Queens Boulevard site to get his service, to get his emergency cardiac surgery. You know, the cardiac program touches 1.5 million Ontarians, 10% of our population. So it has quite a reach and span. Do you see how we make that difference, not just locally, but regionally?
Oh, absolutely. You know, we think of our hospital as being our local community hospital, but it really does. It is a regional program. So you're right. We actually, I thought it was 1.4 million, but I guess we're up to 1.5 million now that we care for. But up to the tippy top of the Bruce Peninsula, and all through Georgian Bay, down Lake Huron and over, we care for them for a cardiology standpoint and for the acute cardiac needs, not just for our cardiology program, but our cardiac surgery program. And while those patients do have to travel a distance to get to us, we're still geographically much closer than where they would have had to go get care before this program opened. And so we are shaving off hours of valuable time in getting those patients seen. But it really is a vital resource to all of those communities we serve.
And how do you see the program evolving?
It's a really exciting time. I've seen so many changes over the past 15 years. Since I started coming here, locuming 15 years ago, and then coming on staff full-time 13 years ago. Care is much more minimally invasive now. The length of stays are much shorter. We're getting patients home and independent much faster. But we're also focusing more on the longitudinal care, the prevention from the start, the rehabilitation services after they go beyond our walls, supporting them in their own homes. When you look at our remote patient monitoring for our heart failure populations, heart failure or congestive heart failure, as a lot of people know it, it's the most common reason for admission to hospital in Canada. And a lot of these patients have a revolving door. They're coming in and all the time. And we have hundreds of patients now, not just here, but across that broad region of that catchment area of 1.5 million, where patients are actually in real time sending data, their blood pressure, their weights, their symptom burden, to our facility here in KW. And our team of experts in the heart function clinic are then able to help modify their treatments while they remain at home, so they can stay at home and thrive independently, as opposed to having that revolving door coming back to hospital. And so I think, where I see things going, it's more minimally invasive, for sure, when it comes to the procedures, but also just smarter care and being able to keep those patients in their home and avoid coming into hospital in the first place.
So how have donors helped develop the program we have today?
None of it would have been possible without donors. Really, it was the drive from many donors and community members that is the reason why we have the cardiac program in the first place. It was that push to get cardiac care closer to home that came from that base that led to this program. But you can't provide the services without the equipment required to provide those services. And, when people invest in those technologies, innovations, or all of the equipment we use, they're really investing in the community. Cardiac disease will touch all of us, whether it's us personally or whether it's a loved one. It's that common. There's none of us who get through this life without being touched by cardiovascular disease. So investing in the cardiac program is really an investment in ourselves and our families and our community, because those are patients who may not have a good outcome because they would have had to go farther afield for care if we didn't have the program here.
I'd like to just turn the conversation to one of the projects that the WRHN Foundation is asking the community for support. So we have 2 cath labs today, and the hospital is looking to expand to a 3rd. So just starting, though, what is a cath lab? What does it do? How does it fit in that care pathway?
For sure. So we take for granted that people know what we're talking about with cath labs, but a cardiac catheterization lab is the full name for it. Is the specialized facility within the hospital where patients go for interventions on their heart. So this is where lives are saved by ballooning open an artery in the throes of a heart attack, for example. We even replace heart valves minimally invasively and do other invasive procedures now in the cath lab. So it really is the heart and soul of a cardiac program, is being able to do those diagnostic and interventional treatments within the cath lab.
So why is a third lab important?
So as I referenced earlier, our volumes of patients that we serve with our 2 cath labs ordinarily would be served with 3 or 4. They're running well beyond capacity. And like any piece of equipment, it's designed to run at a certain capacity, right? Your car motor is designed to run at a certain RPM for optimized efficiency and performance. And cath labs are no different. We're constantly exceeding what that capacity should be on our 2 existing labs. It also allows us to expand to new services that we still have a lot of patients have to go out of region for care for things that we do not have the capacity within our current infrastructure to provide. So that would translate into literally thousands of patient visits per year with the 3rd cath lab that we currently aren't able to provide. And it's not simply 2 + 1 = 3. The added value for the 3rd cath lab goes far beyond just adding a 33% increase to our capacity. It allows us to do scheduled downtime and maintenance on our equipment without compromising patient care. It allows us to introduce those new programs where, as technology advances, to keep those patients here and closer to the families while they receive life-saving care.
Is there anything else you wanted to share about the program and around the cardiac program at WRHN?
It's such a great program to be a part of, and I do see every day the impact of having this program here in our community. There's not a week that goes by that there's not a patient I see in the coronary care unit who may have had a very, very different outcome if we didn't have this service here in our community to provide that timely care. And so it can't be overemphasized how important having this care here locally is.
Well, I must say, I have the privilege of meeting many families, and I just last week actually I met a family. The mom was telling me the story of their son having a heart attack and having to go to emerge, and actually was resuscitated twice during that trip to the hospital and then in the emerge, having the surgery at Queens Boulevard, and then having the cardiac rehab at Chicopee. So it was just an amazing story about the care. And despite all the challenges in the system, they really pointed out the care that's being provided by you and your colleagues and how much they appreciated it. So thank you for everything you do.
Oh, it's a wonderful team to be part of, and couldn't be prouder of them.
Tremendous. If you wanted to leave one takeaway to our audience, what would it be?
I would say that really know that any support for this program is really an investment in lives saved, in independence retained, and keeping families together, because keeping that care close to home really does deliver on that promise.
Well, thank you. And thank you for joining us for the first edition of Inside WRHN. And thank you, Dr. Warren, for joining us and sharing a little bit about what we do at WRHN.
My pleasure.